Hi, my name is Mary Beth Bredinger, and I am the Secretary for the City of Spencer Americans with Disabilities ADA Council. We are a group of caring individuals that meet once a month to improve the lives of people with disabilities. Most people already have or will have some kind of disability in their lifetime. It isn't always something you can see or hear. Some disabilities are mild and some are severe. Some are physical and some are mental. Some people are born with their disability and some are the result of an illness or an accident. Today, I'm going to introduce you to one of our ADA Council members, Eric Erickson, who is with me. You will learn that he is more like you than he is different. Were you born with your disability?
Yes, I was born with my disability. I have a younger brother that's totally normal, does not have a disability, and most moms and dads run a little small risk of having a child with a disability, kind of that 3%. So I caught it, that 3%. I've got 4 fingers on one hand and 4 fingers on the other hand, so missing a couple of bones out of both arms. And I was born with a hole in my heart, born with my eyes crossed, so I was kind of legally blind, and then missing some bones in my ears, so I wasn't able to hear as well. And then within the last 5 years, I went to a place called Bone and Joint and had my left shoulder looked at, and it is actually permanently dislocated. And so I think perhaps I probably was born with a left dislocated shoulder. I am a social worker, and I work for Sanford Health in Sheldon, Iowa. I'm a hospice social worker, so I work with terminally ill patients that are, trying to think here, we've got one actually as young as 25 and all the way up to 101. So kind of walk that journey with them on the last 6 months of their life and try to keep them as comfortable and as pain-free and hopefully achieve any last minute kind of goals or milestones that they want to achieve. Well, with my physical disability, there unfortunately are a lot of jobs that I'm not physically able to do, that I'm not going to be able to do as productively as one might hope. But with at least a social work job, I physically can do it and emotionally and mentally can do it. And I'm hopefully a pretty strong communicator, and I like to sit and visit, and I like to listen. In my disability, I do well with computers, and of course the cell phone is a wonderful little piece of technology, and typing on the keyboard I still do pretty well. They have a natural dragging speaking software out there, so computers and databases I do still pretty well with. So yeah, and the paperwork is fairly manageable with my disability and my writing skills and typing skills. I'm very blessed to have a very loving brother that would help me anytime I needed. He was always there for me. I feel kind of bad. It was almost a role reversal. He almost was the big brother and I was the little brother. But he was there to help and provide support, and I helped him and provided support when he needed help. So worked together hand in hand. In 3rd and 4th grade, very much teased and made fun of, and that was definitely not a fun concept. Very blessed to have a loving mother and father who provided me support and to emotionally get me through some of those traumatic teasings that I got. And to this day, as a young man being 52, 53, I still can point out and remember those kids that very much teased me. So my dad has creative, adaptive tools along the way for me to be more independent and to do more things and whatnot. And ironically enough, I actually use my feet for quite a few things. If you ever see me out golfing, you might see that I'm barefoot, and might think that's kind of strange for an old man to be barefoot on a golf course, but I use my feet for a lot of things. And so yeah, I like to pick things up with my feet. And ironically enough, this is going to sound silly, but I always have to laugh when I see people bend over to take their socks off. And it's like, well, you got 2 perfectly good toes, why aren't you using them to take your socks off? So, well, our society is very much a right-handed society, and I'm kind of left-handed, predominantly left-handed, but I do use my right hand a little bit as well. So I brought a couple of different things, like, you know, when you go to purchase a pair of mittens or gloves, with only having 4 fingers, I've got a mitten, and then I just had the thumb kind of cut off it. So I've got 2 mittens here. Both were cut there. And then putting on a stocking cap, with my arms being a little short and being able to reach, just having these little deals here help pull the cap down is helpful. And then I've got a shirt here as well with the sleeves that are kind of cut on it. So when you go to buy a brand new shirt, you know, get excited, bring it home, you want to put it on. But I've had to have somebody sew and make the sleeves a little shorter for me. And then getting dressed in the morning, because I said, you know, I'm missing the thumb. So I have a little, what we call a little zip hook that helps pull the zipper up so I can get my pants on. And then I have a button hook that will go in with a pair of blue jeans. You kind of go through the little hole, the loop, and grab the button, and then you pull it back. This stick here has a kind of a hook on the end of it, and that kind of helps to pull my socks up or pull my pants up with the belt loops. And then I'm wearing a shirt today, but you can see there's some button hooks, buttons up above, and I use this little button hook to fasten that button as well. So those are some of the things I use to get dressed in the morning. And you know, when you think about getting up and just doing your thing, it might take me an extra 15 or 20 minutes to be able to get dressed. So I gotta get up a little earlier and be a little more prepared. You talked about challenges, just simply reaching, getting into cupboards and just being able to reach and needing step stools. And you know, you go grocery shopping, it's not fun to go grocery shopping because I see things that I can't reach, and having to ask for help, you know, can be kind of challenging. I don't like to ask for help. I like to be independent, but as you get older, you need to ask for help. Mm-hmm. I went out and bought at least 4 different step stools so I can reach what I need to reach, because there's constantly with things up, paper towels or Kleenexes or laundry soap, or, you know, this is going to sound silly, but to even just hang my clothes, I'm a little short, so to have a step stool so I can reach to put the hanger on the rack there can be challenging. So just having all those step stools. A lot of my top shelves are pretty much empty. When I can't reach, I don't put the stuff in there. And the older I get, it's not as safe to be climbing up step ladders and step stools. So I drove here. I still ride horses. I can still drive a motorcycle. I can still snow ski and fly a kite, and even play basketball and football. And I love to golf. I did a lot of golfing last year. I just kind of physically adapt to, like, when I ride a motorcycle, I might sit a little closer than I should, and some people might think I'm going to do a head dive over the front wheel. But even like a recumbent bike I purchased, which allows you to sit and my head's up and I can steer a lot better. Snow skiing was really pretty easy. I'm pretty strong with my legs. I don't know if you guys are familiar with tow ropes, where you grab an actual rope that pulls you up. I had to learn how to really grasp that. I don't know if you've ever been out snow skiing, but when your gloves, in about an hour, your gloves can get pretty wet and they don't seem to hold the tow rope as well. But there's tricks of the trade to learn to really grasp and hold that. So yeah, I like to snow ski, and I enjoy fishing. That's another thing I enjoy doing. Golfing's probably my #1 thing I really enjoy doing. I think just being understanding, being patient, just taking the time to get to know somebody, ask questions, and just being kind and friendly and nice and supportive and understanding more than anything, and to know that it's okay to be different. You know, I might be somebody who you don't run across very often. There aren't a ton of people with my disabilities. In my lifetime, I think I've only met probably less than 20 probably. I'll bet I was probably 21 before I finally met the first person that had a disability like mine. So I am different. I think it's okay to come up and ask questions. You know, I'm something different, and I would encourage you, you know. Want you to learn and grow, and you know, the more questions you ask, the more answers you can get. You need to really be positive, kids. I know this world's a little challenging in this day and age, but to really try to be positive, to see the goodness in the world, and to be a friend. I can't encourage that enough, to be a friend, and to be a friend with somebody that might have some challenges and what the rewards might be. And just being a good neighbor, being a good person, but just being positive, trying to make sure you're doing the right thing. Live life to the fullest. If you don't succeed the first time, definitely encourage you to do it the second time. You know, I guess I would really try to give you young kids a real message that just because we're different doesn't mean we don't want to be normal. And I would encourage you to take the advantage, and I would challenge you, I guess, to make a friend. And you might be surprised what that other individual might have to share the gift and can teach you, and would challenge you to make a friend and get to know somebody and make a difference in their lives, and gives you an opportunity to grow and get to know somebody.